Congresswoman Tlaib. Yeah.
Sorry, I didn't know I was next. Thank you so much. It really is incredibly important that you all are here to talk about this particular issue, especially as a woman serving the United States Congress. I just want to personally thank you for defending my right to choose. One of the things I want to discuss is the impact of politically motivated restrictions of abortion that we've been talking about, access to maternal health, but even around infant mortality. When I served 6 years in the Michigan State Legislature, I was always taken aback by so much time and effort and debate and conversation around the right to choose versus infant mortality, maternal health, all of those things that I think are interconnected with some of the, reasoning behind folks that want to support life, right? And there is an issue that is deeply, concerning to me is that parts of my home district have among the highest maternal mortality rates in the country. In 2014, a woman giving birth in Detroit was 3 times more likely to die in childbirth than the rest of the country. Infant mortality in Detroit is double the national rate in the country. And it just goes on and on. And so, Dr. McNichols, Missouri was one of the highest rates, has the highest rates of maternal mortality in the country, and it continues to rise, especially among women of color. In fact, Black women in Missouri are 3 times more likely to die from pregnancy complications than other women. Is that correct?
That is correct.
Which state official, again, is responsible for addressing maternal mortality in Missouri?
That would be the director of our Department of Public Health, Dr. Randall Williams.
So Dr. Williams is, in fact, the same official that has spent state dollars on enforcing unnecessary pelvic exams on women and tracking their menstrual cycles of Planned Parenthood patients, correct?
Yes.
How do you think that he should be spending time on? What do you think he should be doing right now? And again, around the same ideals, right, that they're supporting this. Mm-hmm. They won't support the women that are having children.
Mm-hmm. Yeah, you raise a great point. Under Dr. Williams, Missouri went from 42nd in the country to 44th in the country in maternal mortality. And while he's spending his time and resources on visiting Planned Parenthood multiple times, he could be focusing on things like addressing maternal mortality, addressing the systemic and institutional racism that is ingrained in that rate of 3 times higher for Black women. He could be working on improving access, particularly for our rural women. Missouri is one of the states who, because we haven't expanded Medicaid, hey, that's another thing he could do. Mm-hmm. We have rural hospitals closing at alarming rates. So if you want to continue your pregnancy, your chance of having a healthy pregnancy is sabotaged by the fact that there's no hospital that you can go to get care during that pregnancy. There are a number of things that he can be doing to address maternal mortality.
I know, the hypocrisy is so unjust and absurd. Ms. Howell, your organization did a phenomenal study finding that Black women face greater barriers to access to reproductive health care, including abortion care. What are some of the factors that you think account for the discrepancy in health outcomes?
Some of the factors are that Black women are disproportionately get their health insurance from Medicaid, which already then bans their access to abortion care and to get coverage. So what happens is that when they find that they are pregnant and they decide they want to terminate a pregnancy, they have to go through a number of steps. They've got to figure out how to afford it, how they can take off work, how they can get child care, how far they have to travel. One of the things that we did is we asked Black women in a poll, what are all the factors you take into account when you're deciding whether or not to have a child? And it wasn't just about having money. It was also about having a neighborhood where neighborhood services were happening. It was about being able to get quality food sources. It was about clean water. There were a number of factors, and if you are a woman of low income and you get your health care from Medicaid, you also have all these other factors that come into. And that's why when we were talking about no one knowing all the reasons why someone might decide to terminate a pregnancy, our organization trusts Black women to make those personal decisions that are best for themselves and their families. And the other side clearly does not trust us to make those decisions.
No, they want to control us. Thank you so much, and I yield the rest of my time.
I thank my friend from Michigan for her powerful voice for her state. And I now call upon